Exertional heat illness, recognition and management. Within this video, we will be looking specifically at the differences between exertional heat stroke and heat exhaustion. Signs and symptoms of heat exhaustion include a rectal temperature less or equal to 104 degrees Fahrenheit, excessive fatigue, syncope or collapse, minor cognitive changes such as dizziness, headache, or confusion, pale skin, possibly cool, clammy skin, or hot and wet skin, dehydration, diarrhea, lightheadedness, and staggering. Signs and symptoms of exertional heat stroke include a rectal temperature greater or equal to 105 degrees Fahrenheit, personality changes, combativeness, confusion, dizziness, staggering, syncope, dehydration, diarrhea, drowsiness, fatigue, headache, hot and wet skin, and vomiting. As you can see, many of the signs and symptoms are similar. Combativeness or personality changes will be a telling differentiation that there's a high likelihood of an exertional heat stroke case. We're going to walk through a scenario in which it is the first week of football conditioning. The athletes are not in equipment yet. You, an athletic trainer, witness an O lineman collapse after pacing around for a little while. When you reach him, he is conscious and breathing. After a while, he becomes combative and isn't acting like himself. You decide to activate the EAP and direct an athletic training student to call 911. It is always a good rule of thumb that if there is a question on heat exhaustion versus heat stroke, obtain core temperature via rectal thermometer. Here is a short video on how to use the rectal thermometer.
Now that we understand how to recognize exertional heat-related illnesses, we're going to move on to the actual use of the rectal thermometer. Use of a rectal thermometer is safe, simple, and requires no forethought, which is why it is highly recommended by the National Athletic Trainers Association. So moving right into it, the first thing that I want to mention is that when performing this procedure as an athletic trainer or any form of healthcare professional, we need to make sure that we're wearing gloves. That was probably a huge red flag that jumped out. I just want to say it from the get-go that gloves need to be worn. So when an athlete is suspected of suffering from exertional heat-related illnesses, we need to move them to a shaded area or an area indoors. This could be if you're fortunate enough to have an easy-up tent or a large tree that can provide shade away from the large crowd of people, or it could be an athletic training room or locker room. So even though we might move them away from large crowds of people, we still need to maintain patient privacy. This can be done covering them with either a sheet or towels, because the examiner will be sliding down the shorts of the athlete to about mid-thigh. This is for the reason that we can gain access to the anal sphincter, which is where the probe will be inserted. So moving into use of the rectal thermometer, we're using a Datatherm today. So with it, it comes with the thermometer and probe. They are both already attached. Sometimes a thermometer and probe will come separate, so it's important that before insertion, we make sure that it's properly connected. We want to make sure it works by turning it on. And we want to make sure as a healthcare professional that has been cleaned with isopropyl alcohol before inserting it into a new patient. So lubricant in the form of Vaseline in most cases should be used to allow for an easier slide into the anal sphincter. When we're actually going ahead to insert, the examiner, when they're sitting on their side, can grab the top gluteal cheek to kind of open up and allow for easier access. When we insert, we are going about 4 inches or 10 centimeters in. If the examiner feels any sort of resistance or apprehension while putting the probe in, they should stop, remove it gently, and attempt again. Once the probe is in, to ensure that it stays in for the duration of the treatment, some tape is provided. You can also use your own tape that you can just stick to the gluteal cheek or somewhere on the skin so that if the probe were to want to slide out, it wouldn't be able to. This could be whether the athlete starts moving his or herself, or if we decide that we need to move them to a cold water immersion tub. Like I said, the probe should be kept in during the duration of the treatment. So once we or the athletic training staff has deemed it safe to remove the probe, this could be that we're ready to transport and the temperature is appropriate, or the temperature is appropriate and we are not going to transport. We're going to remove the probe very gently and slowly, and then immediately start the sterilization process so that it is safe if this needs to be used for another athlete in the future. So as you can see, it is quite simple to perform this procedure as an athletic trainer. With just a few simple steps, you could be en route to saving somebody's life with this gold standard technique.
Once the patient has been moved to a shaded area and the rectal thermometer has been positioned properly, it is determined that the thermometer reads 106 degrees Fahrenheit. Rapid cooling must begin as soon as possible. A cold water immersion tub ranging from 35 to 55 degrees Fahrenheit should be pre-prepared, especially during high-risk events. The athlete is moved with the assistance from other athletic trainers and coaches. You continue to monitor vitals, including blood pressure, heart rate, respiratory rate, and rectal temperature throughout the duration of treatment. Fluids are also given to the patient. Ensure that there are additional personnel who stay close to help keep the athlete in the tub and someone near his head to ensure that he will not drown in case he were to lose consciousness. The athlete should not be removed from the tub until his core temperature is under 102 degrees Fahrenheit. Upon arrival of EMS, it is important to stand your ground and not allow transport until core temperature is under 102 degrees Fahrenheit. This should be communicated with EMS at least annually to avoid any arguments when an emergency is occurring. If it is not possible to attain rectal temperature for any reason, the patient should be immersed for 15 to 20 minutes before transport occurs. Here are some takeaways of items that you should have gathered while watching this video. Overall, exertional heat-related deaths are 100% preventable. With the proper plan in place, preparation, and ability to recognize when action must be taken, nobody should die due to heat-related illnesses.